Hi, I'm Steve Adubato. Thank you so much for watching. It is our honor to introduce Rebecca Love, who is the president of an organization called SONSIEL and vice president of OptimizeRx. Good to see you, Rebecca.
Thanks so much for having me, Steve.
We're talking all about nurses. We're talking about the nursing profession, particularly in the age of COVID. What is SONSIEL and why is it, or how is it connected to the nursing profession?
So SONSIEL is an organization, 501c3, that stands for the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, and was formed basically by a group of nurses that came together to redefine the appearance, the knowledge, the expertise, and the view of what is possible for nursing, not only today, but in the future of healthcare.
So let me ask you this. 2020, year of the nurses, year of the nursing profession. And our friends at Johnson & Johnson have, been advocating this. That's how we met, advocating nursing and the nursing profession and nurses, and they introduced us to your organization. But that being said, what I'm curious about is this. To what degree are nurses getting the support that they need being on the front lines in the war against COVID?
So I think this is a challenging situation for all nurses on the front lines of COVID. I think that there's been a tremendous shift in healthcare, that nurses are being put in directly into the front lines, where a lot of professions have been pulled back from the front lines. So you're seeing them crossing the threshold. There's been shortages and challenges with PPE, support systems, and also shortages of staffing. Substantial challenges, downward pressure facing the nursing profession.
So let me ask you, I asked a dean, one of the deans of a large nursing school, I believe is at Seton Hall University. And I asked about the impact this is having on folks wanting to go into the nursing profession. And she said, enrollment's up. So my question to you is, how would you describe morale of existing nurses and the nursing profession overall?
So I think morale of the traditional nurses on the front lines is strained, stressed, and feeling overburdened with a system that currently needs to change substantially to keep engaging them and keeping them safe. That being said, I think under any type of pandemic or any place that you feel like you're going to war, there are going to be people that are recognized for their heroism and their hard work. And because of that, I think people are looking at the world today and realizing if there's one profession that can truly make a difference to touch people's lives, nursing is that profession. And I think in the environment of COVID, where so much is remote, the idea of caring for somebody else in their darkest moments and actually making a true impact is probably what is driving that surge of the next generation. And actually, I am thrilled to hear that the dean is saying that, because for decades, we've actually seen downward enrollment in nursing and the best choosing to go into the profession. So I'm thrilled to hear you say that.
We're actually taping this. By the way, you're in Boston. I want to disclose that. You are up in Boston. We are in New Jersey. Back in May, there was an event that SONSIEL partnered with J&J and also Microsoft on, it's called the Nurse Hack for Health, COVID-19 Virtual Hackathon. What was it and why does it matter?
So nurses are the end user of nearly every product on the market in healthcare. And what we're finding in the era of COVID is so many nurses were not having their ideas heard or put forward. And so we approached J&J and Microsoft and said, let's do a hackathon together in the era of COVID, because so many of these nurses have tremendous ideas to deal with the challenges that they're facing on the front line. At that time, SONSIEL had been hosting virtual nurse meetups for nurses around the world every week that were walking into their shifts, that were on the hospital floors, sharing advice, sharing ideas of how they were treating these patients. And we recognized a lot of this innovation was not being heard by the outside world. So we approached J&J and Microsoft and we said, let's do a hackathon. And if you're not familiar with a hackathon, that's those 3-day events where people come together, pose problems, and create solutions in a weekend. And the goal was to really identify that innovation and make it happen on the front lines, and for the frontline nurses to basically feel that they were finally heard about the problems they were seeing and the solutions that they could come up with over the course of the weekend.
You mentioned innovation. I'm a student of leadership, a student of innovation, and its connection to leadership. So let me ask you, to what degree do you believe the nursing profession moving forward, Rebecca, will change dramatically and forever because of COVID?
I think it's inevitable that the future of nursing is going to change in remarkable ways. And I think for the first time that I'm hearing from any of my colleagues on the front line, I think that there has been a change or a slight pivot in the way that the world of healthcare looked at nurses. But for a very long time, I think the world of healthcare has always believed that there was going to be more nurses. They saw us as more of a commodity and a task deliverer. I think when COVID hit and all the systems recognized, the only people in the system who had a 360-degree view of everything that happened on a hospital floor was nurses. The respect for their knowledge and expertise insurmountably increased their value within the healthcare system. You're going to hear incredible stories of nurses who basically have come forward and created all of the processes, new products, and new ways to deliver care during COVID in a time when many other providers, for fear, were stepping back. It was only the nurse on the front line dealing with and managing those patients in all hours of the day, from the moment they crossed that threshold to the time that they passed.
Yeah, I said this to that dean of nursing, and I'll say it to you on behalf of everyone in public broadcasting. It shouldn't just be 2020 that is the year of the nurse. Every year should be, for obvious reasons. So, Rebecca, I want to thank you for joining us. Next time you join us, we'll talk about OptimizeRx, if that's okay.
Thank you so much for having me, Steve, and thank you for celebrating and recognizing nurses.
Absolutely. I'm Steve Adubato. Thanks for being with us. Stay with us because we'll be back after this.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Johnson & Johnson, TD Bank, New Jersey Sharing Network, PSC&G, the Northward Center, the Russell Berry Foundation, NJM Insurance Group, the Fidelco Group, and by the Adler Aphasia Center. Promotional support provided by AM 970 The Answer and by NorthJersey.com and Local IQ, part of the USA Today network.
The essence of the Northward Center is ingrained in our values, thoughts, and actions. What began as a storefront on Bloomfield Avenue has evolved into a life-changing community nonprofit. The mansion is steeped in tradition, but with all of its grandeur, the true essence of the Northward Center is in the people we serve. So as the Northward Center commemorates 50 years of service, let's also celebrate the many opportunities yet to come.